Hello, Namaste, Dr. Chirag Chovatia. I'm a practicing physician in South Bhopal area of Ahmedabad. Today, I would like to speak about the dissolution technique in the Telmisartan formulation. As we know, Telmisartan is a angiotensin receptor blocker, ARB, which is approved for treating high blood pressure. The mechanism is the drug binds to AT1 receptor with high affinity, causing inhibition of the action of angiotensin 2 on vascular smooth muscle and ultimately leading to a reduction in the arterial blood pressure. The solubility of telmisartan in aqueous solution is strongly pH dependent, with maximum solubility observed at either ends at high and low pH. It is seen that different brands of telmisartan may not produce equally desirable clinical effects at the same dose, and thus variability in therapeutic response is one of the problems with telmisartan. Different factors responsible for this therapeutic response are highly variable. Pharmacokinetics properties like extensive first pass metabolism, low solubility, and high permeability as BCS class 2 drug presence of food, use of excipients, diluents, lubricants, and so many other factors that ultimately affect the pharmacokinetics. Well, it has been seen that absolute bioavailability of telmisartan is about 42% at 40 milligram and 57% at 160 milligrams. So what basically it means that this half or nearly half of the drug is absorbed, no matter how much drug is being given. The solubility in aqueous solution is strongly pH dependent, with maximum solubility observed at high and low pH. That is a pH of 3, that is a low pH, acidic pH, and a pH of 9, which is an alkaline pH. So at these pH, the maximum absorption is occurring. Now, what happens? The cascade of poor bioavailability. That's how it starts. It starts where it starts with the poor solubility. After the ingestion, the tablet undergoes disintegration, dissolution before being absorbed, and the rate and extent of which into the absorption, the rate and extent of the absorption into the systemic circulation determines its bioavailability. So what happens is, if a drug start out is poorly soluble, that leads to poor dissolution and penetrability, hence to poor absorption and hence to low bioavailability. So which ultimately results in large inter and intra-subject variation. That is, the BP may fluctuate, the dose of the drug may not be the same, but the effects tend to vary. So with any oral preparations, the drug dissolution profiles may be distinct due to differences in the formulation and manufacturing processes. Now, as mentioned earlier, because of the variable therapeutic response seen with various brands of telmisartan and the unique pharmacokinetic properties of telmisartan, comparison of dissolution profiles and other parameters of generic telmisartan brands with that of the innovator brand is required. So basically what we are doing is we are comparing the innovator brand, and we are comparing with the testing brand. Yeah, so how well it does versus the innovator brand. That's what is being done. So various methods used by manufacturer to overcome low bioavailability and improved dissolution of a poorly water soluble drug is by formation of a solid dispersion and hydrophilic polymer, polyvinyl, pyrrolidone, and other diverse carriers, and the use of alkalizer. These are the various things we can do to promote the absorption of or dissolution of telmisartan, which is per se a poorly soluble in water. That kind of per se that the property is. So what are the things that we can do to improve? So one is water soluble drug is by solid dispersion and with hydrophilic, that is affinity to water, polymer, polyvinyl, pyrrolidone, and other diverse carriers, and use of alkalizers. So the alkaline medium is made because we cannot do too much acidic medium, so we have to do alkaline medium. So when we do alkaline medium, that's how we improve the dissolution and absorption and bioavailability. So sodium hydroxide is considered as a strong alkalinizer as it provides maximum solubility for telmisartan. Some of the generic and innovative brands contain sodium hydroxide, and it creates a micro environmental pH around telmisartan granules, and thus enhances the solubility of telmisartan in the intestinal fluid. A unique technology is used by companies wherein micronized telmisartan granules, primarily mixed with suitable alkalizer, sodium hydroxide, an open-label two-arm randomized parallel study conducted to assess the bioavailability of Telista, that is the brand we are concerned with, Telista of telmisartan, 40 milligrams or 80 milligrams or 160 milligram tablet formulations in 18 healthy male volunteers. The telmisartan peak plasma concentration is achieved within 30 minutes of oral administration, and Tmax is 1 hour. The dissolution medium selected is pH 7.5 phosphate buffer, which is a media specified for telmisartan tablet as per the FDA OGD guidelines. That is 900 ml and 75 RPM maintained at 37 plus or minus 0.5 degrees Celsius. USP requires not less than 75% of the labeled amount dissolved within 30 minutes. The dissolution of more than 80% of the drug should be released within 1 hour, is following the pharmacopoeial specification. So now with all this being done, compared with Micardis, the innovator brand for telmisartan, which has about 94.68%, Telista, our brand has shown, this brand has shown 96.68 of the drug release. That is almost 2% higher than the innovator brand, Micardis, the innovator brand. It's the dissolution and bioavailability is almost 2% higher for Telista. What are the salient features of telmisartan dissolution profile? One is that sodium hydroxide, a strong base, is used to dissolve the drug, and that's how it improves its dissolution and absorption. Alkalizer used for improving dissolution profile in telmisartan tablet is as per the innovator brand of telmisartan, that is Micardis. The dissolution method selected is pH 7.5 phosphate buffer, which is a media specified for telmisartan tablet as per FDA OGD guidelines, and that is 900 ml and 75 RPM and 37 plus or minus 0.5 degrees Celsius. The USP requires not less than 75% of the label amount to be dissolved within 35 minutes. And pH 7.5 is the recommended buffer pH in the United States Pharmacopoeia. So all these guidelines are being followed, and with that, whatever is being done, it has been found that there's a 2% more drug release and bioavailability with the Telista as compared to the innovator brand Micardis. Development of dissolution method was validated accordance with ICH guidelines because providing the method is experimentally sound, yielding precise, accurate, and repeatable results. So that's all. To conclude, as compared with Micardis, Telista has shown more dissolution and bioavailability by 2%. So thank you all for taking out time to listen to my podcast today. Thank you. Thank you very much. Dr. Chirag Chovatia signing out.